everyone. I am Dr. Sheetal Kumar, physician and diabetologist at Yashoda Hospital, Secunderabad. Today I am going to discuss regarding the hypertension. Blood pressure is defined as the amount of the force exerted by the circulating blood on the walls of the blood vessels. So the normal blood pressure value is 120 by 80 millimeters of mercury. It is called hypertension when systolic blood pressure is more than or equal to 140 millimeters of mercury and diastolic blood pressure of more than or equal to 90 millimeters of mercury. If the blood pressure remains for prolonged duration of more than 140 by more than or equal to 140 by 90 millimeters of mercury, it is called hypertension. And if it is persistent, then it is associated with many complications, especially cardiovascular complications. In India, the prevalence of hypertension is around 22.8% among 15 to 49 years of age individuals. And among these, 50% are newly diagnosed. And the problematic thing is only 12% of total hypertensive population in India between ages of 15 to 49 are under control. Remaining are not under control. That may pose a serious complication of cardiovascular deaths in India. So what are the risk factors for the hypertension? So if there is any strong family history, definitely they are going to get the hypertension in the near future. And with the advancing age, blood pressure is going to increase. These are non-modifiable risk factors as we can't change the family history or genetic composition or the advancing age. So in these situations, there is every chance of getting blood pressure. So these persons who are having family history of hypertension should be more cautious. And other risk factors like unhealthy lifestyle, unhealthy dietary habits, smoking and excessive alcohol intake, use of tobacco in any terms, any ways like smoking, chewing tobacco, all these things will lead to occurrence of hypertension in individuals. So other risk factors are high salt intake, especially in way of stored foods, junk foods, and not taking sufficient foods which contain high potassium, which is helpful for reducing the blood pressure or avoiding getting blood pressure. Especially foods which are having potassium are coconut water, fruits, and green vegetables. And excessive amount of processed food intake and stressful life. So all these things will lead to development of blood pressure. So these type of individuals who are getting blood pressure may not have any signs and symptoms of having blood pressure. That is why the hypertension is called as silent killer. When the blood pressure is of insidious onset, it starts very slowly without any signs and symptoms. The patient may suddenly present with the cardiovascular accidents or cerebrovascular accidents or with the renal failure or even with the loss of vision. So all these things are secondary to the uncontrolled or undiagnosed blood pressure. So what are the things we have to do to avoid or to postpone the occurrence of blood pressure? So to avoid the risk factors, so you have to follow a healthy lifestyle. So regular physical activity, at least 30 minutes per day of aerobic exercises, and quit smoking, quit excessive alcohol intake, avoid junk foods, avoid stored foods or foods which are readily available to eat, avoid excess salt intake. And the persons who are having strong family history of hypertension, they should be more cautious. So they should be checking their blood pressure at regular intervals. Nowadays, devices for home blood pressure monitoring are available. We can utilize them and we have to check our blood pressure at least once a week, especially in individuals who are having family history. They should be more cautious. They should be avoiding smoking and alcohol intake, and to adapt for a healthy diet which contain green leafy vegetables, fruits, foods containing potassium like coconut water. So avoiding non-vegetarian diet if possible, So all these things will help them in postponing or avoiding getting blood pressure. And most important thing is, once they are diagnosed with the hypertension, they should uh, accept that they are having hypertension. So not to mock themselves and try to adhere to the treatment which is prescribed by the doctor. Then after starting the treatment also, you can start physical activity if you are not doing regularly, and accepting regular and healthy diet habits. In these situations, you can either decrease the dose of your medication, and sometimes we can stop the medication also. But once you have diagnosed, if you are not taking the medication and try to decrease the blood pressure by increasing physical activity, all those things may cause excess or accelerated hypertension that may lead to complications also. So try to know your disease, try to adhere to the medication, try to adopt healthy lifestyles, and try to be healthy. Thank you very much.